How is pure tone audiometry performed during a hearing screening? Imagine stepping into a quiet room where a friendly professional prepares to check your hearing. Pure tone audiometry during a hearing screening involves playing specific tones at different pitches and volumes to see how softly you can hear. The goal is to find out if your hearing is within normal limits or if there might be some hearing loss that needs further investigation. The process begins with the examiner explaining what will happen and why it's important. They make sure you understand that you should respond whenever you hear a tone, no matter how quiet it is. To avoid bias, you are positioned so you cannot see the audiometer controls, and the room is kept very quiet to prevent background noise from interfering with the test. Next, the equipment is set up. The audiometer, a special device that produces pure tones, is prepared to deliver sounds at frequencies from 250 Hz up to 8,000 Hz. You will wear headphones that fit snugly over your ears, usually red for the right ear and blue for the left. These headphones send sounds directly into your ears through air conduction. Sometimes, a bone vibrator is used behind the ear to test bone conduction, which helps determine if hearing loss is caused by issues in the outer or middle ear or deeper in the inner ear. Before starting the actual screening, the audiologist might give you a quick practice. They will play a tone at a comfortable volume, often around 2,000 Hz, so you know what to expect. They might ask you to raise your hand or press a button whenever you hear a tone. This helps you get used to the process and ensures you respond correctly during the test. During the screening, the audiologist plays pure tones at specific frequencies, usually 1,000 to 1,000, and for 1,000 Hz, at a volume level that is typically between 20 and 40 decibels. You are asked to respond each time you hear a tone. If you respond at the screening level, the test moves on to the next frequency and the other ear. If you do not respond to a tone at this level, it might mean your hearing needs further testing, and you could be referred for a full diagnostic audiometry assessment. If more detailed information is needed, the audiologist can determine your hearing thresholds. This involves gradually lowering the volume of the tone until you no longer respond, then increasing it slightly to find the quietest sound you can reliably hear at each frequency. This process is done separately for each ear. The results are then plotted on an audiogram, a graph that shows your hearing sensitivity across different pitches. The audiogram helps professionals understand whether you have normal hearing or some degree of hearing loss, and what type it might be. It is important to note that factors like recent exposure to loud noise can temporarily affect hearing, so the audiologist may ask about your recent noise exposure. They also ensure the testing environment is calm and comfortable to help you respond accurately. Pure tone audiometry is considered the gold standard for hearing screening because it is reliable, non-invasive, and provides vital information about your hearing ability at speech-related frequencies. However, it only measures your ability to detect tones and does not assess how well you understand speech or locate sounds, which might requiring additional tests. Always remember, if you have concerns about your hearing, consult a healthcare professional for personalized advice and further evaluation.